All right, Chapter 12, Community Assessment and Evaluation. So this chapter clarifies community concepts and provides a guideline for nursing practice with the community client. So what is a community? A community is a group of people and the relationships that emerge among them as they develop and use in common some agencies and institutions and a physical environment. So people are the community residents, place both the geographical and the time dimension, and function, the aims and activities of the community. Community as a client. So it's really important to understand that with public health nursing, it's not really just community health nursing. Yes, we do focus on individual care in a sense, but mainly the community is our client. So what's best for the community? What are we focusing on? A community practice setting is insufficient reason for saying that the practice is oriented toward a community client. When the location of the practice is in the community, but the focus of the practice is individual or the family, the nursing client remains the individual family, not the whole community. So the community as a client requires that the improved health of the community is the overall goal, for the greater good. That's the overall goal of the nursing intervention. Change to benefit the community client often must occur at several levels, ranging from individual to society as a whole. So it doesn't mean you ignore the individual, because collectively, a group of individuals make the community. However, you have to understand that the total outcome is based on the community number, not just the individual. I know that gets confusing, but you just start kind of practicing thinking the community as the client. So community as client and partner in nursing practice. Direct clinical care and be a part of population-focused community health practice. So how does that look? Well, everybody, the sum of the part is greater than each individually. So when you're practicing with these patients, you're looking toward the entire community. So that's when we talk about vaccination scheduling. Of course, vaccinations help the individual, protect the individual, but for the most part, most vaccinations work in a sense with herd immunity. So if everybody is vaccinated against a vaccine-preventable disease, there is not a weak host that the virus or bacteria can jump from to create a larger scale bacterial or viral endemic so that it would stay alive. So the point is, so many people have been immunized against polio that there was no vector that the polio could remain in to stay alive, so that polio basically was eradicated in the United States. And that's called herd immunity. Now, the less and less people who get the polio vaccine, the more and more chance that the polio virus can jump from person to person and get stronger and start spreading to other people. So that's why, so when you work in a practice that's very focused on immunizing everybody, that's very population community focused. You want to improve health of the community, and that remains the overall goal of the nursing intervention. So another example of this you could look at is infant mortality or total overall life expectancy. So I work for the city of Cincinnati, and we look at that as our overall goal when we are assessing how we did for the year. So, you know, it's not that it's not that we don't care about the individual, because we do. Again, you know, I look at each individual person carefully, and I specialize their care to them. I'm not just giving cookie cutter care, but there's definitely certain things that I do to improve overall community health as well. So an example of this could be, you know, community health has a high risk of COPD because there's so many smokers, so encouraging someone to quit. Not only does it help overall individual health, obviously, but overall community health. Getting people to lose weight so that they can be productive in work, because a productive person contributes more to the community. So thinking more overall. So the change occurs at several levels, not just at the individual level, but also at the community level. So two key concepts, community health and partnership for community health. So goals and means of community-oriented practice. Goals, so nurse and community seek healthful changes together. Community health has three common characteristics: status, structure, and process. So status involves the physical. So morbidity, mortality rates. How many people within a community are getting diabetes? How many are dying from diabetes? Emotional, client satisfaction. And then social status. What are the crime rates? What's the poverty level? What is the education level? Those are things that actually contribute to overall health of an individual and a community. So structure, services and resources in a community, and then process, effective community functioning or problem solving. So I feel like many of you live in the tri-state area of Cincinnati, from what I'm hearing. But for those who don't, so we live in it's kind of an interesting community. There's a mixture of different socioeconomic levels as well as cultural levels. And it's quite interesting to see how they're trying to improve overall. But, you know, working within churches, so African American churches are actually a really great way to work with health because just studies have shown the African American population tend to have a strong church base and also respond to church outreach whether they belong to that church or not. So within the city of Cincinnati, there are several outreach programs for diabetics to give diabetic support through the churches, and that has improved in many communities the hemoglobin A1C of the community, which is what we use to measure control of diabetes and to diagnose the diabetes. So I just think that's really interesting how we do that. The same with the Latino population, especially those who are new to the U.S. They work through the church system as well, and it is quite nice because it's a safe. They feel safe. It's a safe environment, and then they feel comfortable dealing with their health there. So those are ways community health providers can work with the resources within the community that they were serving to provide care for their patients.